We know that our FDA has in many ways failed us by not allowing for the use of ivermectin and hydroxychloroquine, both of which are used around the world to reduce COVID hospitalizations and deaths.
I pelted them with questions about COVID-19 and the vaccine and therapeutics, hydroxychloroquine, ivermectin, as well as other proactive treatments and practices were already helping COVID-19 patients all across the country.
On June 5th, Weinstein discussed the benefits of a drug called ivermectin, which can and is around the world used to treat and prevent the spread of the coronavirus.
Okay, so you've probably heard for, let's say, a year and a half now that first hydroxychloroquine and then ivermectin, they're the solution to all of your problems. Despite the fact that there was and is no evidence of that, it's been pushed by incredibly powerful people with a massive financial interest in cowing the right-wing population, getting them to oppose mask mandates, vaccine mandates, those sorts of things. It's just, all you need is ivermectin, all you need is hydroxychloroquine. Well, as we've gone through, there are many studies that have been conducted to try to figure out if there is any benefit to these things in helping to get rid of COVID, limit the severity of cases, keep people at the hospital. And I will start by saying, I wish it worked. I would love if you could just go down to Tractor Supply and start gobbling up all sorts of goat and llama medicine and have that cure COVID, because COVID is terrible. And I want whatever possibly works to be found, but it doesn't work. And in this video, we're gonna talk about the biggest study yet done on ivermectin. Researchers took a look at it and found that it didn't reduce hospital admissions. It didn't help in fighting COVID. One of the leaders of the study says there was no indication that ivermectin is clinically useful. They looked at 1,358 adults who visited one of 12 different clinics in Brazil with COVID symptoms. They'd all been rapid tested for COVID and all had reasons to believe that they could experience severe cases of it. So the researchers prescribed half of them a course of ivermectin, the other received a placebo, and they tracked the patients to see whether they were hospitalized within 28 days. They looked at whether patients on ivermectin cleared the virus from their bodies faster than those who received a placebo, whether their symptoms resolved sooner, whether they were in the hospital or on ventilators for less time, and whether there was any difference in the death rates for the two groups. So if there was any potential benefit across many different metrics, they would have found it. And they looked at it in multiple different ways, looking at data from patients and then analyzing data from patients who received ivermectin or a placebo 24 hours before they were hospitalized. There was a third different review. They gave it the best chance possible. And in the end, they found that ivermectin didn't improve patient outcomes. It's not the solution to all of our problems. But the people who've made money on YouTube pushing it, they already made that money. There's no apologies coming from those people or from Fox News. They jumped into it not because they were excited for a potential treatment or they were convinced by the evidence that never existed. It was a convenient alternative to getting people to be part of a societal solution to our problems. Socially distancing, taking it seriously, wearing a mask, getting vaccinated, getting boosted, the things that have actually been proven to work, that puts us all together. And they're not interested in America being together, Ida. They're interested in being the captains of division, and they benefited mightily over the past 2 years.
Yeah, listen. I understand the lack of trust that people have in the government, that people have in big pharma, that people have in all of the corporations that benefit greatly from all of the horrible things that happen to us. That being said, you know what I did during COVID? I talked to the medical professionals that I knew in my own life, the doctors that I knew, the nurses that I knew. I had nurses that were in the COVID places, taking care of COVID patients when it was really bad, not just here in New York. And I had the conversations with those people who I know are not getting paychecks from companies. And I will tell you that, a lot of people lost their lives during COVID because they just didn't have basic information to keep themselves alive because they were being driven by these, by Fox News and the people who were getting vaccinated and taking all of the precautions. And just because you don't see them on air wearing masks does not mean that they were not wearing masks when they were around other people. They were just telling you what they wanted you to hear because they know that you belong to this emotional group of people that if they give you the talking points, they can get you exactly where they want you to be. And where they want you to be is spending money on stuff that they benefit from, voting for candidates that put up money in their pockets. And they want to continue to keep you ignorant because they make a lot of money out of it. And I feel sorry for the people of the world that have had to be victim of all of these talking points during a time where everybody was just scared and struggling about how to get through and how to survive this thing. And we're still doing it because COVID hasn't gone anywhere. Just the politics around it has changed, but they haven't found a solution. It's just amazing to see, to hear all of this. And I feel sorry for the people. I wasn't going to take a medication because a podcaster told me to. I wasn't. That's just not what I'm going to do because especially somebody who has 99 million more dollars than me. Mm-hmm. And it's not because I don't think that person is intelligent or I think that person is stupid. I just am not going to play with my own life that way because I know that we are not the same. And that's just sad how people have been driven into this place where they just don't know what to do because they're desperate.
Yeah, they are. They don't know who to trust. They've been told for decades not to trust basically anyone with any level of expertise. And in particular, during the pandemic, they were told not to trust the CDC. Don't trust any of these people. Just trust, your favorite person on Fox News that night. Like trust that person. That person's got your back. That person doesn't give a damn about you. That person is incredibly wealthy. That person has been vaccinated for a year and a half. And the second a booster is available, they're gonna take it. And it doesn't bother them at all. The countless thousands of their devoted, loving fans have needlessly died because they listened to bad advice from those people.
Yeah, the only podcaster I'm listening to is a scientist that is proven, or someone who is actually been in the medical field and knows what they're talking about. Yeah. You cannot let the celebrity worship in this country has led to a lot of people's death. The way you worship Donald Trump or Joe Rogan or Don Lemon or anybody who is famous to you, Kim Kardashian, Kanye West, these people are leading you to your slaughter because they are profiting from your ignorance. And you should go to the people who know what they're talking about. I mean, when it comes to your baby, you're gonna go to the pediatrician, right? Because you love your baby. You're not gonna let somebody on the street corner tell you what to do with your baby. Well, the internet now is the street corner.
Yeah. Go to like a Dr. Oz. Get somebody with some medical. I'm kidding. Anyway, don't listen to I don't find out how to deal with cancer from Pod Save America. Seriously, don't do these things.
Check out the Damage Report podcast each day, wherever you get your podcasts, whether Pocket Casts or Stitcher or iTunes. You can join me as I give you the news and stories you want, with a range of co-hosts and interview guests jumping in on the fun each day. Again, that's the Damage Report, wherever you get your podcasts. And if you get them at iTunes, don't forget to rate and review. Sometimes I'll read them live on the show.